here to testify in support of the Hospital Profit Transparency and Fairness Act, S622 and House 979, which will require hospitals to be transparent about their financial holdings and claw back excessive profits and funds spent on exorbitant CEO compensation to ensure taxpayer dollars are instead dedicated to safe patient care and necessary services for all communities in the Commonwealth. Hospitals and large healthcare corporations are putting profits before patients, with CEOs making millions while patients and communities serviced by these hospitals are being put at risk. Every hospital, whether it's profit or nonprofit, gets, on average, over 50% of its money from public funds. These bills would ensure that the public has a clear picture of the financial health of the hospitals that serve their communities. The public and our public policy makers have a right to know where their public health dollars are going, especially when they're going to foreign bank accounts. In the instances of services cut and hospital closures, healthcare executives cited financial uncertainty and insecurity as the reason behind these cuts and closures. And yet the profits earned by Massachusetts Hospital continue to increase, according to the latest report from CHIA, as do the compensation packages provided to hospital CEOs. And while you may hear today that that is necessary, that research shows there is absolutely no correlation between CEO compensation and the quality and safety of care these hospitals provide. The proposed legislation has 4 key provisions to address this situation. First, a facility that accepts funds from the Commonwealth and whose patient mix is less than 60% government payer and reports an annual operating margin that exceeds 8% will be subject to a civil penalty equal to the amount of profit that exceeds 8%. Second, if a hospital that receives taxpayer money compensates its CEO annually more than 100 times the annual compensation of its lowest paid full-time employee of that hospital, the hospital will pay a fine equal to the amount over that cap. Third, every hospital that receives taxpayer money will be required to disclose all financial assets, including assets held in offshore accounts. We know that every major network in this state, including Bay State Health, Partners, Leahy, and BI, have accounts in the Cayman Islands, yet they're not required to report how much money is in these accounts. Taxpayers have a right to know how much of this money is sitting in an offshore bank account, especially if those taxpayers live in a community that has just lost a hospital. Finally, these bills create a new fund on the Commonwealth's books called the Medicaid Reimbursement Enhancement Fund, funded by the penalties for the excessive CEO compensation and profits described above. This fund would be used to improve Medicaid reimbursements to eligible hospitals. The public has a right to know how and where their health care dollars are being invested, particularly at a time when hospitals are using the current financial climate as an excuse to degrade or limit the care they are providing to vulnerable patients. Thank you.